Well, thanks for being with Morning Live. Now, imagine something like premenstrual syndrome or PMS, but only worse. Now, the premenstrual disorder that disrupts women's lives, premenstrual dysphoric disorder or PMDD, is said to occur in 3 in 4 women. So 3 in 4 women, or at least that says 3 in 4 women experience premenstrual physical or mood changes, but for women suffering from premenstrual dysphoric disorder or PMDD, the monthly symptoms are more than just annoying or uncomfortable. They actually affect the ability to work. It impacts on relationships and increases risk of suicide. Now, while premenstrual syndrome or PMS is well known, affecting at least 75% of women, PMDD is a more severe form and it's recognized as a clinical mental health condition, and it affects approximately 5% of women. So to help us unpack and understand what we are dealing with here, we're joined by Dr Marshinee Naidoo, who's a member of the South African Society of Psychiatrists. Dr. Naidoo, thanks for your time. Welcome to Morning Live.
Thank you.
So firstly, if you could perhaps just more succinctly explain to us the difference between PMS, premenstrual syndrome, and premenstrual dysphoric disorder or PMDD.
So PMS, as you've explained, is quite common. It affects 3 in 4 women. Up to 75% of women could have PMS, and it's usually the more physical symptoms that occur the days prior to the menstrual bleeding. Oftentimes breast tenderness, headaches, back pain, a little bit of mood symptoms, irritability, a bit of sadness. But PMDD, or premenstrual dysphoric disorder, is quite a crippling form. We say it's the monster of the PMS, where there are significant mood changes that actually give this condition a diagnosis under psychiatric conditions. The mood fluctuations in terms of mood swings are quite debilitating for the woman. Severe sensitivity, intense irritability, anger outbursts, together with a low, sad, down, depressed mood, which could rise to suicidal thoughts, suicidal ideation, with a third of women actually attempting suicide during this time, as well as extreme anxiety symptoms. So basically, it's quite intense emotional symptoms together with the physical symptoms of the PMS, and oftentimes also cognitive dysfunction, a subjective feeling of difficulty in concentrating, and the woman just feeling as if they lose control. So yeah, it's a very severe form of PMS.
And really does sound very debilitating. But are we able to, give some guidelines to our viewers as to what they can look out for that would distinguish a PMDD from PMS? Are there any specific indicators that one could look out for?
But I think the biggest criteria that we look at is it really interferes with functionality. So be it social, occupational, leisure functioning, a woman's unable to do her usual work requirements, or whether it be at home. Oftentimes, it's quite severe that, when we look at the difference between PMS, PMDD, and other psychiatric conditions like depression or anxiety, oftentimes around the time of the period, the days preceding the period until the menstrual bleeding, the symptoms are quite severe. And then there's relief in the days after that, with almost complete absent symptoms thereafter. So a very cyclic pattern. So oftentimes, it's important for a woman to be aware of her mood changes around the period, from the little, or should I say the smaller mood changes, to quite intense mood fluctuations that alter her level of functioning. As I said, quite crippling to her functionality in various aspects of her life.
And speaking of, very often we hear women complaining about period pains, for example, and your bosses would say, well, that's no excuse to skip work or, to skip school for younger women or other obligations. But what if it is associated with PMDD? How do we know? How do you get a proper diagnosis and support? Are doctors able to tell the difference, quite readily?
Look, it's often misdiagnosed and it's quite misunderstood. So I think if a woman is having severe PMS symptoms and has an index of suspicion that they may have something more serious, it is important to consult with a mental health practitioner or a psychiatrist, or alternatively a doctor that understands female mental health together with gynecological concerns, and getting to the diagnosis of what this is, because it's not just a bad mood or being hormonal. There's actually a biology behind it where women who suffer from PMDD are actually quite sensitive to the normal hormone fluctuations in estrogen and progesterone that occur around the menstrual cycle. So I think it is important to consult with a mental health professional like a psychiatrist or a doctor that specializes in female mental health to get to the bottom of this, because there's treatment, that's the disorder is quite treatable, which is quite good.
So what sort of treatment is available, Dr. Naidoo?
Well, as you mentioned, oftentimes the physical symptoms can become quite severe. And in that regard, hormone treatment such as the combined oral contraceptive pill gives good success in treating cramps and the physical symptoms. However, because PMDD has a big element of it that's emotional and mood swings and depression and suicidality, there's great results with antidepressants, selective serotonin reuptake inhibitors, which really alleviates the mood symptoms. There's various other options depending on if a woman has completed her family, and more severe conditions where surgical interventions could be a treatment modality. But oftentimes, just treatments with antidepressants or combined oral contraceptive pills give quite good relief. There's also various, over-the-counter medication, supplementation, which is best discussed with your doctor on which ones are the best to use.
And of course, stress as well. Many women really struggle under very stressful conditions. We know many South African households are female-headed, and this is usually the only household leader in that particular household that could sometimes take care of various members of their family. But also, you had COVID-19, which also exacerbated those stress levels for various reasons. Does that contribute, would you say, Dr. Naidoo, to PMDD?
Definitely, because during the time of the period of PMS, everything seems more overwhelming than normal for a woman. And I think having all the added responsibilities that we do as women just adds on to the stress. And, it's known that these increased stress levels in terms of cortisol levels, together with the normal hormone fluctuations, can really make these symptoms worse. So again, SASOB's call out for Women's Month is to raise awareness so women are quite informed. And they seek help early on. We're trying to promote early detection in mental health. And with regards to stress levels, just, women supporting women or families supporting each other, just to be a little bit more gentle, sensitive to a woman's needs during a difficult time when hormones are quite fluctuant.
Well, Dr. Naidoo, we really appreciate your time this morning. Dr. Marshinee Naidoo, a member of the South African Society of Psychiatrists, speaking to us there about PMDD, which is a worse form of PMS and added symptoms there. So as Dr. Naidoo said, this is about awareness. So if you have any of the severe symptoms, fluctuations in your mood that are quite severe, I think that perhaps one indicator that perhaps there may be something more going on, and please look to it.